Hi friends, it's Dr. Ladda here, and in the last class about the urinary bladder, a question for 20 marks in the paper second, we completed our two the external features of the urinary bladder. We started with the intro and then features and then shape, size, and finally we end with the external features of the urinary bladder. Now in this video, we are going to proceed with the relations of the urinary bladder. We know friends, urinary bladder has apex, base, neck, surfaces and borders. Now these all portions, they had their own relations. Before proceeding with the relations of the urinary bladder, let's have a little look on the pelvis of male and pelvis of the female. We know in female, in the pelvic cavity, at the anterior aspect there is urinary bladder. Behind that there is uterus and lastly there is rectum. Whereas in male, anteriorly there is bladder. Behind that there are seminal vesicles and vas deferens, and just absolute posterior there is rectum. Means while thinking about the relations and all these, we are supposed to consider the bladder of male and bladder of female. Means the relations of male bladder and female bladder vary accordingly. Now move with one by one. We know the apex of the bladder. It is attached to the umbilicus by a ligament. It is attached to the umbilicus by a ligament that is called as median umbilical ligament. Median umbilical ligament. Now the posterior, the back portion, that is the base, and this base has relation with vagina in female and rectum and vas deferens and seminal vesicles in male. So the base is related. The base is related to the uterine cervix and vagina in female, whereas in male, now suppose this is the base, the upper portion of base has its different relation and lower portion has different relation. In male, the upper part of the base in male is related with the rectum, whereas lower part of the base is related with the two parts. One is seminal vesicle and second one is termination of vas deferens. Termination of vas deferens. The base in female is related with uterine cervix and vagina, whereas in male it is related with, means upper portion of the base is related with the rectum, whereas the lower portion of base is related with two structures. One is seminal vesicle and second one is termination of vas deferens. So these are the relations of base in male and female. Now about the neck. We know in the last video we discussed that neck is most fixed part of the urinary bladder. Even the bladder is full or empty, it is the most fixed part. And one thing we are knowing that this neck is pierced by internal urethral, means pierced by internal urethral orifice. Means through this neck the urethra it comes out and it has internal and external urethral orifices. So in male, with the relation of neck there is one gland, prostatic gland, and in female there is no prostatic gland. Now if we are going to think about the relations of neck, we are supposed to move about the neck of your relations of neck in female and relations of neck in male. In female, the neck is related with the pelvic fascia surrounding what? Surrounding directly the urethra, because there is no prostate. So in female, neck is related with the pelvic fascia surrounding the upper part of urethra, whereas in male, the neck is related with smooth muscle bundles. The neck is related with the muscle bundles which are smooth and which are surrounding the bladder, neck and Pre-prostatic urethra. Are you getting? Pre-prostatic means the urethra which is above the prostate before entering inside the prostate. Internal urethric meatus, then urethra is going down, and now before entering into the prostate, this part of urethra, pre-prostatic urethra, and it is related with the smooth muscle bundles which are surrounding the bladder and pre-prostatic urethra. Now superior surface, we know above this surface there is absolute covering of the peritoneum, and above this peritoneum we are knowing there is sigmoidal colon and terminal part of the ileum. Sigmoidal colon and terminal part of it varies in male and female little bit. In female, suppose this is the bladder, now behind the bladder there is uterus. Now this posterior aspect of the superior surface, backside, posterior aspect of the superior surface, it is little having deficit of the peritoneum, whereas other part of the superior surface is covered with the peritoneum. Means in female, the major part of the superior surface is covered with the peritoneum except a small area which is near to the posterior border. Whereas in male, the superior surface is completely covered with the peritoneum and is in contact with, yes, what? Sigmoidal colon and terminal part of the ileum. So this is what about the superior surface. Now we know there are two surfaces which are lateral but inferior. So those two surfaces are called as inferolateral, right inferolateral surface and left inferolateral surface. Now think about these surfaces which are inferolateral. So if you are thinking and if you are observing the figure which is in front of you, you can easily write the relations of these all. These all means neck and your superior surface and apex and all these, because the diagram is in front of you and you are just supposed to copy paste what you are getting in the diagram. So about the inferolateral surface, so this inferolateral surface in female, it is related with inferolateral, it is related with pubis. One, no doubt in male it is also related with the pubis. Then second thing, it is related with pubovesical ligament. Pubo means from pubis up to vesicle means from up to bladder. The ligament which is connecting the pubis to the bladder. Pubovesical ligament. It is in the female. Now in the male, we know in male there is one extra thing, and that is prostatic gland. So the ligament which is taking origin from pubis symphysis or pubic bone, it is going to the prostate. So what could be the name of ligament? Puboprostatic ligament. Yes. Now one is pubis, second is pubovesical or puboprostatic ligament. These two ligaments, and now there are two muscles which are common in both male and female. Those two muscles are a muscle that is levator ani, and second muscle is obturator internus, the obturator foramina. And from inside of the foramina there is one muscle taking origin, and that is called as obturator internus muscles. Now if I am going to deal with, or if I am going to write about the inferolateral surfaces of male and female, I am supposed to write the inferolateral surface of male bladder is related with pubis, number second puboprostatic ligament, and two muscles, one is levator ani and second one is internal obturator internus muscle. In the same sense, inferolateral surface of the bladder in female are related with, because they are two surfaces, one is medial, one is right lateral inferolateral, second one is left inferolateral. So these two inferolateral surfaces, they are related with again pubis. Now here instead of puboprostatic you are supposed to write pubovesical ligament, and the same two muscles, which are those? Levator ani and obturator internus muscle. So these are the relations. These are the relations of the apex, neck, superior surface and inferolateral surface of the bladder. Now your next heading should be the ligaments. Should be the ligaments of the bladder. Now Bladder has both type of ligaments, true and false. What are the true? True means those ligaments which are actually supporting the bladder, and false, they are not playing any role in supporting the bladder. There are 6 true ligaments of the bladder, and among these true ligaments, one is lateral true ligament. What is lateral? Suppose this is the bladder, the ligament which is toward the lateral side of the bladder. Means one lateral and second, means there are 2 lateral true ligaments. Lateral true ligaments. Number second, lateral puboprostatic ligament. Puboprostatic means the ligament which is attaching to the pubis to the prostate. Now in female, what could be? Pubovesical. Lateral puboprostatic. Lateral means suppose I am holding this. Now this is the median plane. The structure which is away from the median plane, that is lateral. We talked about lateral true ligaments. There are 2. Now this one. Now this one. It is lateral pubovesical ligament in female. This is lateral pubovesical ligament in female and lateral puboprostatic ligament in male. In the same sense. Now this is lateral, this is medial towards the medial plane. Now this is medial pubovesical ligament in female and medial puboprostatic ligament in male. And one thing, apex. This is the apex. It is little upward when bladder is full. I think so you are remembering the last video. We talked about when bladder is full, its apex get attached with the umbilicus by means of a ligament, median, not medial, median in center, median umbilical ligament, and last ligament which is in the category of true ligament, that is posterior ligament. So these are the true ligaments. Among the true ligaments, let's have a small revision. Among the true ligaments, there are 2 lateral true ligaments. Lateral true ligaments. Number second, lateral puboprostatic in male and lateral pubovesical in female. Number third, median puboprostatic in male, median pubovesical in female. Why vesical in female? Why not? Because in female there is no prostatic gland. Now next ligament is median umbilical ligament which is attaching the bladder to the umbilicus, and last one is the posterior ligament. So these are the ligaments. Now you are supposed to explain the ligaments. Just we discuss how they are and how they just you are supposed to write about the direction of ligament and from where to where they are attached. Means you are supposed to take one by one heading and put 2 to 3 lines together. That will create a fine impression of your answer, which helps finally in scoring the marks. Yes. Now this is what the true. Now second category is false. Now in category of the false ligament, there are median umbilical fold. It is not ligament, it is fold. Median umbilical fold. One. Second one is medial umbilical fold. Median means at the center. Medial means toward the median plane. Medial umbilical fold. Lateral, number third, lateral false ligament, and number fourth, posterior false ligament. So these are the ligaments of the urinary bladder. There are 6 true ligaments and 4 false ligaments, and which all are under the heading ligaments of the urinary bladder. Now your next heading is interior of bladder, and we know bladder has irregular folds. Bladder has irregular folds. Among these folds there is a triangular area. There is a triangular area which is with the smooth muscle fibers, and this triangular area means between the opening of 2 ureters and lower end at the opening of internal urethric orifice. This triangular area, it is deficit and it is composed of smooth muscles, and this triangular area is called as trigon of the bladder. It is called as trigon of the bladder. Now this is what about the interior of the bladder. Now the capacity of the bladder. Next heading. Generally, roughly, the bladder has a capacity of 220 ml urine. 220 ml of urine. It varies from 120 to 200 ml of urine bladder can store. And now about your nerve supply and blood supply and applied anatomy. In applied anatomy, you are supposed to, if bladder is full, and suddenly there is an accident or something, and if you have any trauma over the abdomen, definitely there are chances of rupture of the bladder. If the prostatic gland is enlarged, we know the urethra is passing through the prostatic gland, definitely the urine will not expel fully. Some residual urine remain in the bladder, and that residual urine may leads to cause infection or inflammation of the bladder, that is called as cystitis. Now third applied anatomy is your vesicle stone, means a renal calculi in the bladder, and that calculi also leads to cause that is bigger one calculi, you can say staghorn type calculi in the bladder. So this is the applied anatomy. So friends, with these all headings, if you are putting together with one by one and taking help of 3 to 4 figures, you can cover 15 marks out of 20, and these headings and all these presentation, it will create a fine impression. Thanks for watching the video, and hope so we will continue with a new video of anatomy within few days. Thank you. Please subscribe my channel for more and easy videos.